Hello, welcome. So I've had a number of therapists ask me a couple of questions about the same thing, which is, a clinical question again, which I'm totally okay with and fine with sharing. And this question is really about developing a case concept, right? So, as therapists know, when you do this work, when you're working with people, the first important thing to do is develop a case concept, right? So, we're going to talk a little bit about case conceptualization. What is a case concept? Why do we do it? And how do we do it, right? Okay, so to begin with, the case concept is the idea, right? The idea or the concept that you as a therapist come up with about the client's issue and the purpose that this issue serves in the client's life, right? And you come up with this case concept based on the information you get from the initial consultation, individual assessment, or family assessment, and sessions 1 and 2, right? So you really want to have had a few to several meetings, 3 or 4 meetings with this client or family or couple if before you develop a case concept, because you want a lot of knowledge. You're assessing this whole time, assessing what's going on, trying to figure out what's happening. So with your case concept, you're going to develop this by looking at both stated and unstated information, right? So, what are they saying about their problem? What are you picking up about their problem? What's the body language you see when they talk about it? What's the tone of voice you hear when they discuss it? What's the family history? Are there patterns? All that sort of stuff is going to come into you coming up with your case concept, right? Their emotional expression, their mood, their affect, their family and social history. What is all of that telling you about this issue? And then you're going to ask, what purpose does this serve for the client, right? And when I say what purpose does this serve, I want you to think of this in a couple of ways. So let's say we think about the issue of depression, right? We work with a lot of people who are depressed. Now, is this client coming to you for depression because of their recent breakup and they're grieving, they're mourning the loss of a former partner and now they're depressed and this is why you're dealing with the depression? Maybe, right? Is this person coming to you and deals with a lot of like negative self beliefs or negative core beliefs and they come from a family where this is what's been spread and transferred from parent to child, this negative view of self that then leads to depression? Is that part of the schema that you're seeing with this person, with this family, and that's causing the depression? So your case concept really matters, makes a big difference in terms of where you're going to go in the work. And it's okay for your case concept to change. If you're a good therapist, then your case concept will change because you're going to try different interventions and different strategies based on your case concept. If you're not using a case concept in your work, then you're not doing therapy. You're doing interventions. It's just like throwing muck on the wall and seeing what sticks, right? When you actually use a case concept, you're thinking through all of these different elements. You're coming up with a concept of the case. You're working with the client ongoing, and you're going to try different interventions based on your case concept, and which is fed, also by what they're telling you. If you're an interventionist, then all depression looks the same, is the same, and you're going to do your CBT, negative self-talk, your depression skills with them, and that's going to be it. So you really want to be conceptualizing cases um, when you're doing this work. Okay, next thing. So yes, your case concept is your picture of the client and their experience, your story about their experience and why it is happening. Okay. So again, are you an interventionist or are you a therapist? And if you're doing therapy, you have and you understand the strong role and the need for a good solid case concept when you're doing this work. Um, Now, I'd be more than happy to, have some more discussion. Shoot me your questions and have a great day.